Hello, everybody. My name is Taylor, and today we're going to talk about auditory processing disorder, or APD, and how families can support children who experience these listening challenges. This short training is designed especially for parents and caregivers, and my goal today is to give you practical tools, helpful resources in the San Diego area, and strategies you can start using right away at home. Before we begin, I want you to think about this question. Have you ever had to repeat instructions several times to your child, even though you know they heard you? For many families of children with APD, this happens often. Today, we'll talk about why that happens and what we can do to help. So, what exactly is auditory processing disorder? Well, APD happens when the brain struggles to interpret sounds correctly, even though the child's hearing itself is normal. In other words, the ears are doing their job, but the brain is having trouble organizing and understanding the sound signals it receives. For example, a child might hear the teacher say, "Take out your math book, turn to page 20, and solve problems 1 through 5." But what the child processes might sound more like, "Take out your math, page 5." You might also hear it called central auditory processing disorder because the difficulty happens in the brain's central processing system rather than in the ear itself. Children with APD often find listening especially difficult in environments with background noise, fast speech, or lots of verbal information all at once. Before we go any further, it helps to understand a few key terms related to listening and communication. Professionals who work with APD, like audiologists and speech language pathologists, often use terms that describe how the brain organizes sound, how language is processed, and how listening connects with learning. Understanding these terms helps parents and educators better recognize what a child may be experiencing and how to support them effectively. One of the tricky things about APD is that it doesn't always look the same in every child. However, there are some common patterns. Children might struggle to understand speech when there's lots of background noise, have difficulty following multiple verbal instructions, lose focus easily when sudden or loud sounds occur, or have trouble remembering information they only heard verbally. Because listening is so closely tied to learning, APD can also affect reading, spelling, writing, and understanding abstract ideas. Some children may even struggle with humor, idioms, or figurative language because they process language more literally. When parents or teachers suspect APD, the child may be referred to a hearing specialist called an audiologist. Diagnosis usually involves several specialized tests that measure how the ear and brain respond to sound. For example, tympanometry checks how well the eardrum moves. Acoustic reflex tests observe how the ear reacts to sounds, loud sounds. Auditory brainstem response tests, or ABR tests, measure how sound signals travel from the ear to the brain. And evoked potential tests look at how efficiently the brain processes those signals. Together, these tests help determine whether hearing is normal and whether the brain is having difficulty processing sound. The good news is that children with APD can benefit from several supportive strategies and interventions. Some children use hearing aids or listening technology that deliver the speaker's voice directly to them. Another common tool is an FM system, which reduces background noise by transmitting the speaker's voice directly to the child's device. There is also auditory training where children practice structured listening exercises designed to help the brain better recognize and interpret sounds. Some programs even use computer-based training tools which turn listening practice into interactive activities. These approaches aim to strengthen the brain's ability to process sound over time. Beyond formal therapy, there are many everyday strategies that can help children with APD succeed. Simple changes can make a big difference. Changes such as reducing background noise at home or in the classroom, making sure the child is looking at you before speaking, using clear and simple sentences, speaking slightly slower and louder. Teachers can also support students by allowing them to sit near the front of the classroom, providing written notes, or offering recorded lessons. These small adjustments help make listening less overwhelming and give children a better chance to process what they hear. Families often feel overwhelmed when navigating a diagnosis like APD. Fortunately, there are several local audiology clinics, therapy programs, and support groups available in the San Diego area that specialize in auditory processing challenges. These organizations can help families connect with professionals, learn about therapy options, and find community support. Another important piece of support happens within the family system. Helping siblings understand APD can build empathy and reduce misunderstandings. Families can also incorporate listening games, maintain predictable routines, and create a balance between quiet listening time and active play. Open conversations about frustrations and successes can strengthen family teamwork and help children feel supported rather than isolated. There are also several helpful books for families and educators who want to learn more about APD. These books include expert explanations, real-life stories, and practical strategies for supporting children with auditory processing challenges. Some focus on helping parents understand the condition, while others are written specifically for children to help them feel seen and understood. Together, these resources remind families that children with APD can absolutely build strengths and succeed with the right support. To wrap it up, auditory processing disorder reminds us that listening is more complex than we often realize. Even when hearing is normal, the brain's ability to interpret sound can affect learning, communication, and confidence. With early recognition, supportive strategies, and collaboration with families, teachers, and specialists, children with APD can thrive both academically and socially. I want to thank all of you for taking the time to learn more about auditory processing disorder and how to support children experiencing these listening challenges. Parents play an incredibly important role in helping children build confidence and develop strategies that make learning easier. If you have any questions, I would be happy to answer them. Thank you.